Hello, I'm Jeff Patterson, Chief Executive Officer for Nacogdoches Medical Center, and welcome to another episode of Ask a Nac Doc. Today I'm with Dr. Annie Gunter, otolaryngologist. Thanks for coming.
Thank you so much for having me.
We are so excited to have you in town. You've been here about 3 months. Tell us a little bit about your family.
Yeah, so I'm married. I have 2 kids. I have a almost 3-year-old boy and an almost 1-year-old boy. So definitely busy with that at home. Yeah, we've been in Nacogdoches 3 months and love the people, love the culture here.
Oh, we are very excited to have you. And what are some things that you do for both the adult and the pediatric population?
For the pediatric patients, most of your bread and butter things that we'll take care of is going to be tonsillectomy, adenoidectomy, and then we treat recurrent acute otitis media with ear tubes and any type of neck masses that you might see in the pediatric population as well. And then for the adults, see a lot of nasal obstruction, allergies, treat a lot of sinusitis, head and neck cancer, thyroid nodules, parathyroid disorders, any type of hearing, vestibular complaints, trouble swallowing, voice issues as well.
One of the things that I've been able to learn from you is just some of the great technologies you leverage to have good outcomes for patients. You want to talk a little bit about the Stealth and some of the things that provides as far as giving exact navigation to make sure patients have good outcomes.
So if we're seeing folks for chronic sinusitis and we decide that you need surgery, we're probably going to order a CT scan that is protocoled for navigation, especially in situations where the patient has nasal polyps, has previously had sinus surgery, has altered anatomy, maybe has a tumor, or anything that's going to complicate the surgery and make identification of the landmarks intraoperatively a little bit more challenging. So I use the Stealth in those situations to avoid critical structures that we're dissecting around when we're doing the surgery, such as the globe, the brain, and the carotid artery. Once we get the patient in the OR, we actually have their scan up on the navigation device, and then we trace out some reference points on the patient's face once they're asleep in the operating room. We register our instruments to the patient to make sure that it's going to be tracking with our navigation system. And so when we're in there doing the surgery, we can confirm that our instruments are tracking anatomically on the place on the scan to confirm our landmarks and making sure we're staying safe.
You just completed your service in the military. Can you tell us something about your training and your service?
I commissioned into the Army when I started medical school, and after medical school I went and did my residency at Madigan Army Medical Center in Tacoma, Washington. Positioned at that Army base, we saw a lot of active duty soldiers, retirees, dependents of the soldiers as well. And then after I was done with residency in Washington State, I went down to Central Texas, Killeen, Texas specifically, and I was stationed at Fort Hood. And that's where I continued my military service and continued to take care of active duty soldiers, retirees, and their families. And I really enjoyed it.
Well, we are glad to have you in Nacogdoches. I really appreciate you taking the time to meet with me today. And we thank you for joining us for another episode of Ask a Nac Doc.